What if I told you that without warning, a pregnancy can grow outside the womb and become life-threatening? Hi, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. I help you understand what's really going on inside your body using simple explanations. Today, let's talk about ectopic pregnancy, what it is, how to detect it early, and why ultrasound can save your life. What is ectopic pregnancy? Ectopic pregnancy happens when a fertilized egg implants outside the uterus instead of inside. The most common place is usually the fallopian tubes, but it can also happen in the ovary or in the cervix or in the abdomen. That is rare, but it is also serious. And the truth is, this pregnancy cannot survive and can become very dangerous if it is not treated early. What causes ectopic pregnancy? You might be wondering, why does ectopic pregnancy even happen? It usually happens when something blocks or slows down the movement of the fertilized egg on the way to the uterus, that's the womb. Some of the main causes include: number one, damage to the fallopian tubes. The fallopian tubes are like a pathway. If they are damaged or scarred, the pregnancy can get stuck there. The common reasons for damaged fallopian tubes or scarred fallopian tubes could be previous infections like untreated STIs or pelvic infections. Another reason ectopic pregnancy could happen is if you've had previous ectopic pregnancy. If you've had one before, the risk of having another one is higher. Number three is surgery in the pelvis or the tubes. Any surgery around the fallopian tubes can leave scar tissue behind. Number four is hormonal imbalance. Hormones help to move the egg, so if they are not balanced, movement can be affected. Number five is fertility treatment. Some assisted reproductive methods slightly increase the risk. Number six is smoking. This may surprise people, but smoking affects how the fallopian tubes function. And sometimes it happens even when none of these risk factors are present. That is why early ultrasound is important for every pregnancy. Think of it like this. The uterus is like the house or the home, and if the road leading home is blocked or damaged, the pregnancy may settle somewhere that it shouldn't. And this is very dangerous because the womb is the only organ in a woman's body that has the ability to expand as the baby gets bigger and carry a baby for 9 months. No other location in the body can do this. So if pregnancy is implanted outside the womb, as the pregnancy grows, it can rupture the fallopian tubes, causing internal bleeding. This is a medical emergency and can be life-threatening. There are symptoms to watch out for, although some women don't notice early, but here are the warning signs. Number one, we have lower abdominal or pelvic pain. We have vaginal bleeding, sometimes shoulder pain, dizziness or fainting. If you notice any of these symptoms, please don't ignore them. How does ultrasound help in all of this? This is where ultrasound becomes very important. We check if the pregnancy is inside the uterus, and if it is not seen there, we start looking outside. We start looking everywhere else. On ultrasound, we may see an empty uterus, a mass in the fallopian tubes, free fluid, which may sometimes suggest bleeding. Early scan can literally save your life in cases of ectopic pregnancy. So if you have missed your period and tested positive, don't wait too long to do a scan. The first scan is usually recommended around 5 to 6 weeks. This helps confirm that the pregnancy is in the right place. There are common misconceptions, and let me clear this. Not every early pregnancy pain is normal. And no, ectopic pregnancy is not something that herbs or medications at home can fix. The pregnancy will have to be terminated. I have seen a case of an ectopic pregnancy where the baby was still alive around 8 weeks, but it had to be terminated because as the pregnancy grows, the risk is very high for the mother. She asked me if there is no way to move the baby into the womb because the baby was very well and alive but in the fallopian tubes. Sadly, there was no way for such, and she cannot carry the baby till term. The pregnancy had to be terminated. The longest an ectopic pregnancy can survive is 12 weeks, and that depends on the location where it implants. If it implants in a very tight corner of the fallopian tubes, at even 6 weeks, the risk of rupture and internal bleeding is high. Like I mentioned earlier, only the womb can expand and continue expanding to accommodate a baby. So when your body speaks, don't ignore it. Early ultrasound can make the difference between a simple treatment and an emergency. If this has helped you, share it with someone. It might save a life. If you have any more question or confusion, feel free to drop it in the comment section. Don't forget to like, share, and subscribe. Follow me for more simple ultrasound explanations, and I'll see you in my next video.